Well, welcome everyone to today's webinar, A Digital First Healthcare Transformation, Reimagining the Consumer Experience with a conversation with Adventist Health. My name is Jacob Emerson with Becker's Hospital Review. I'm your moderator today, and on behalf of Becker's Healthcare, thank you so much for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a panel-style discussion, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with the audio, try refreshing your browser first. You can also submit any technical questions into the Q&A box. We're here to help at any time. With that, I'm thrilled that you're all joining us as we discuss the changing expectations of today's healthcare consumers and how organizations can meet and exceed those expectations with personalized, relationship-based care driven by a digital-first philosophy. We're joined by Jason Wells, Chief Strategy Officer at Adventist Health, a faith-based nonprofit integrated health system serving more than 80 communities on the West Coast and Hawaii. Jason is leading the charge at Adventist Health to realign the organization around the consumer by transforming the patient and consumer experience through improved access to care and easier processes, services, and solutions that better address overall health and well-being. We're also joined today by Michael O'Neill, founder and CEO at GetWell. Michael started GetWell with the goal of improving the patient experience following his own time as a patient. Through partnerships with some of the most progressive hospitals and health systems in the world, including Adventist Health, GetWell's digital technology is designed to improve the healthcare experience for patients, their families, and clinicians. We're here today to discuss Adventist Health and GetWell's shared goal of reimagining the healthcare consumer experience. So Jason, tell us about your 2030 vision. What brought you here, and why did Adventist Health believe that a digital-first strategy was the right answer?
Hey, thank you, Jacob. Great to be a part of this. We knew that we needed to change. It's sometimes in legacy healthcare, it feels like, if you imagine a New York City taxi cab convention, everyone just very proud of their $1 million medallions and thinking they've got a corner on this market and not worried about these little disruptors called Lyft and Uber and others. And we have had pretty much a corner on the market for decades. We've gotten pretty lazy in healthcare. And I would say every industry's probably changed around us. And we have now seen the disruptors come in and appropriately disrupting things. And we've got to be far more aligned around the consumer. So we know part of our 2030 strategy and launched that before the pandemic. So really, let's talk 2025. We have had to accelerate that tremendously, knowing that consumers have far different expectations. They will move with their feet. They're telling us they expect a whole lot more, and they want to see the virtual experiences. They want to see the digital experiences. They want to be engaged in their care. We're trying to move from just being, let's call it transactional healthcare, where we're doing things to patients, and actually doing things with them and building those relationships. So empowering individuals to be a part of their journey, creating an integrated network across the entire care continuum. No longer can we think of ourselves as 23 hospitals up and down the West Coast, but as that complete integration from the primary care, from all the interactions in between a hospitalization, which is usually just very few in a lifetime, to the post-acute. And so you think of the rivers of streams into healthcare, we've got to be in that prevention space. We've got 1 foot in fee-for-service, 1 foot in new value models, taking on risk. Got to keep those populations healthy, and that's going to come through this great bi-directional engagement as we try to take costs out of this very expensive system.
Thank you, Jason. So, Michael, it's clear that Adventist Health understands that consumer expectations are changing. Can you talk a little bit about how GetWell is helping healthcare organizations rise to that challenge of these evolving expectations?
Sure. And first, thank you, Jacob, and the whole Becker's team. You guys are great at what you do, and providing us a platform to share and learn is just really important. So thank you. And then, Jason, it's always great to share space with you. You have this unique ability to kind of think big but work small, and that creates such vision and alignment, and it puts things in action now instead of waiting for the perfect time, which kind of never exists. So it's really just an honor to walk this walk with you. Now, as for expectations of our consumers, look, we all know this because we are consumers. We are largely, and sometimes unfairly, dissatisfied with our healthcare experience. of course, as consumers, we want it to feel like Amazon and Netflix and DoorDash, because that's what we expect today, as digital consumers. In fact, I think COVID kind of baptized the entire population as digital natives. It's no longer just our kids, but it's all of us. And I think COVID also kind of removed the past that we historically have had in healthcare, where consumers kind of expected to wait for 50 minutes before seeing their physician in a waiting room. And they used to be okay on hold on an 800 number for 14 minutes in a queue. And they used to be okay visiting a website and pecking around for information they needed. Well, it's a new world now. So I guess at GetWell, we kind of help organizations, I think, in three primary ways. The first is to bring this outside consumer digital first lens and experience into healthcare. We have staff here and professionals who have built everything from Marriott's Bonvoy app, those of you who are business travelers, to all kinds of different consumer digital experiences. And so, number one, our job is to bring that outside in consumer first lens into our client partnerships, into the discussion. The second thing I would say in parallel is, but you better do this with a deep understanding of the complexities of healthcare. We have been at this work for 22 years. And of course, it's easy from the outside to say, hey, why isn't it just like Uber or Amazon? Well, there are reasons for that. Privacy is a challenge. Security is a challenge. Compliance is a challenge. And so the second thing that we actually do is to make sure that we are steeped in the complexities and the empathy and the understandings of the systems, the processes, and the people that we rely on in healthcare who are trying to do this very important and very difficult work in a challenging environment. And then third, we have to do this work in full appreciation and with participation with our clinicians. So we have doctors and nurses and clinical staff here at GetWell. We work hand in hand with the clinical staff in organizations like Adventist. So the third piece is to make sure that we're not designing these tools, albeit for the consumers, but not in the vacuum of consumerism, because the clinicians are a critical piece of getting this right.
Absolutely. I want to talk a little bit about the digital first experience. When you're referring to a digital first approach to care, what exactly does that mean? And Jason, I want to start with you on that one.
Yeah, Jacob and Michael, love the comments and the partnership. It is important to find a partner that understands the engagement space with patients. It's not screaming at them, yelling at them, telling them what to do, but truly engaging them in that. And this has been a great journey. When you think about digital first, Jacob, I'm thinking about this, and Michael gave a couple examples, and probably many of us for the first time through the pandemic had food delivered to our home and saw how easy it was to start using some of these new companies that have sprung up. All of us probably have had coffee delivered to a local place, and you just walk in and pick it up because it's sitting there ready to go. There's a haircut partner that I use, and you can look at their app and see 17 locations, the wait time, pick one, you're in the queue, walk right in. Those type of tools exist, seems like everywhere but healthcare. And so when you think about digital first, is how do you leverage the phone to create an interaction? So many of us are all doing the obvious, text messaging, patient reminders. That's a must-have in today. The ability to online schedule through your phone. So you can simply take your device, see what the options, and need to find the ability for same day video visits, those type of things. But it's the digital interactions that we're having with things not as complex. If we can do it with coffee and haircuts, we really should be able to do it with our healthcare, with our life. And a trusted partner is our physician and our care team. And so it is all those digital interactions. I'll give you some examples that we've been able to light up through partnerships through the pandemic. So Dormant patient activation. We took a look and we found that we had over 600,000 patients that had seen us 18 months ago, but had gone dark for whatever various reasons. Fear of coming into a healthcare setting because of COVID or whatever that might be. So we have been enacting a strategy with GetWell where we are lighting them up through text messages, very personalized, empathetic, reaching out. Would they like to schedule a visit, come back in, let us re-engage in a well check? And that has had tremendous success of re-engaging through the phone, giving them the tools to click and engage. Service line, we know we got to do a better job. And so leveraging some loops, to coordinate. Right now, we're building out our cardiology loop and taking patients on a pathway. In our Central Valley, we have diabetes patients with our Adventist Health plan and people that are high risk and taking them through a care loop with diabetes. And those are several ways of an example of how we can leverage the cell phone. One thing I would encourage people to do is we made it a required field at registration, both in our ERs, all of our clinics, hospital setting, that we collect the cell phone. It used to be email address was the required. And of course, email, cell phone, and texting has far eclipsed that. And so we're now at 92% cell phone capture rate, and that has really helped us create this engagement as we lean into community health, leaning into our risk-based populations, that we are engaging them on a deeper level, and text message by far has been our most successful medium for that.
Wow, so a 92% mobile capture rate. Michael, what are your thoughts here about defining a digital-first approach to care?
Yeah, I think I just have a macro just comment and then a micro one really at the ground level. So on the macro side, I do think the word's overused, but I think it's really critical. It really starts with alignment. And I would tell you, like, we kicked off our partnership with Adventist through an invitation that they gave us to attend a couple-day leadership, retreat with their leadership team. And it gave us an opportunity before we started the work to really listen to their vision and strategy and participate pretty actively in sharing our view of both the world today and ahead. And so I would tell you that, these partnerships to get the consumer piece right, Jason and his team have invited us. We are at the table. We are solutioning together. We are removing barriers together. We are correcting mistakes, and there are many of them together. And we're celebrating wins together. These guys have done a great job in breaking down this historical client vendor wall, if you will. And so I think I would just say, when you do the thoughtfulness to choose your right partner, you really truly need to partner with them. And this goes both ways. Providers need to be more inclusive of us as supplier partners to them. And us as suppliers need to be brazenly transparent in what we have, what works, what doesn't, when we messed up, how we're going to solve it. And so number one, the macro side, I think alignment in the consumer experience, digital first world, the alignment between the partner, the client, and the supplier is of critical importance. When I bring it all the way down to the ground level, this digital first experience, you need to nail the empathy piece, in particular in healthcare. So of course, in a digital first environment, you have to have the tech. So you have to embrace AI, you embrace mobile, you embrace cloud, you embrace Fire API and open APIs, you embrace the tech, of course. But at the same time, these are real people that we are touching, on a minute-to-minute basis, who are both receiving the care, and these are real people who are delivering the care. And so number one, you've got to make sure that you write with empathy, that when you use AI to send text out to people, they don't sound like or read like or feel like a canned generic campaign. Because those of us who get spammed 3 million times a day, both on our cell phones and in our email, we never respond to them. So you have to really be thoughtful about understanding how to personalize the messages and the content. And then secondly, the tech alone won't do it. A lot of these humans that we're reaching out to with technology are actually going to need a human touch. And I think we'll touch on that a little bit, but it's really been a way for us to augment all this incredible automation with real human touch to reach some of the folks who are very hard to reach, because they're not digital natives, they're not comfortable with doing all this stuff online. So it's a really important kind of combination of the two things.
Absolutely. And let's stay on the topic of the technology you're using to make all of this happen when we're speaking to the patient experience. Jason, how does this technology help personalize the experience for the patient, something that we know is key to your program?
We've named our digital assistant Hope. And so Hope reaches out with, again, it doesn't feel canned. It doesn't feel like we're mass sending out to 400,000 people. It's very, very personalized. And what we've loved about the partnership with GetWell is it's backed up with that human touch. And so we have GetWell Navigators that can step in and have that real conversation and get people to either connected to the care they need, answer the questions in real time. And Michael will give you a few examples of those. But we have had tremendous success stories. One of the concerns is, will a more senior generation be comfortable with this technology. And we have found that text messaging is what they're most comfortable with. Sometimes a complex portal. I know my own parents, 79 and 82. Mom and Dad, if you're watching, I apologize for calling that out. But they're very uncomfortable with their patient portal. They just say, I don't use it. I'm not. But they will text their physician. They will text their care team. They'll text me. And so it seems to me a medium that we've had tremendous success with the senior population. And so that personal touch, we can text in Spanish, we can text in English. We're continuing to push to work for additional languages to really make sure we are reaching the entire community. But it is really starting with that text message interaction that is bidirectional. It's not one way. It's not just a chat bot that you get these canned answers and you feel like you're in this digital hamster wheel loop and you realize I'm not talking to someone, this is a joke, and you kind of walk away from it. So it is that much more targeted personal communication that shows that we know them. This isn't, someone that we just got off a list. And I would say we're moving even to the point of, how frustrating is it to show up to a clinic visit and be given a clipboard to fill out 20 minutes of paperwork that is copied at half of an angle, you can hardly read it. And you're like, I just filled this out a month ago. Don't you still have this? And so really bringing all of those digital connections into the whole experience so we can have a digital check-in and a seamless experience so people feel like we actually know them and remember that we've been caring for them for years.
Yeah, absolutely. And Michael, I'm curious what other practical applications for these solutions that you're using to reach patients and re-engage them.
Yeah, I guess our approach, first of all, to GetWell with these tools are really centered around programs and populations kind of over capabilities. The tech is important, but it's candidly less challenging. We know how to write code. We know how to integrate systems for workflow. And so really the focus, I guess, first and foremost, is really around programs and populations, because the capabilities are kind of, I'd say, table stakes. You better be able to do AI texting. You better be able to personalize these messages and all. And so with that in mind, there are a couple of just practical applications that we think the data is telling us seeing some great promise in. The first is what Jason mentioned. One of the early programs at Adventist was, hey, give us a panel of these 600,000 or so patients who we know need care and simply have not been in, and let's figure out a way to personally get out to them and help them kind of get back into the care they actually need. We are also working with Adventist and others around kind of wrapping our digital arms around every patient that ever gets discharged from a hospital bed, and how can we make sure we stay coordinated with them and kind of walk them back to their primary care physician for follow-up in a very kind of coordinated, personalized, comfortable, empathetic way, so we actually don't miss that follow-up and end up back in the ED. We're also doing a bunch of work around text-only appointment reminders for patients, with primary care, other specialty appointments. So we do a lot of that work as well. We are also, as you kind of see on the screen here, every touch that we have with a person or a patient allows us to begin to build a 360 profile of who they are and what their needs are, not just clinically, but also socially. Like, do they have a hard time with transportation? Are they actually nervous or anxious about their upcoming appointment? Do they not have the money to kind of fill their prescriptions? Whatever the kind of case may be, we have a pretty robust opportunity and platform to collect social determinants of health information, and not just collect it, but more importantly, like arm kind of our navigators and our AI tool with that information to make sure that we're intervening in the most appropriate way to help the patients out on a very personal level. And I think finally, there's also great applications in some of the opportunities and candidly our requirements to reach out to historically underserved populations. So we are leveraging this same set of capabilities to build and target programs, for example, at a group of mothers who happen to be on Medicaid and are having a baby. And how can we figure out how to engage them differently so that they make sure they get the very best care and navigate their journey as well? So we're just finding, quite honestly, not an endless, but a rather like focused set, of call it 6 to 8, really core practical applications that can really aim at direct issues and drive pretty measurable results. So it's been a challenging but really exciting time as we kind of see the data begin to come in.
Sure, sure. And clearly the digital first component of both of your work is very important to the success of this initiative. I want to shift gears a bit, though, and talk about another component to this that adds in a high-touch human component, like you had mentioned earlier. Jason, can you start us off and tell us about the Navigators that are working with Adventist Health patients? Jason, I think you're muted.
Oh, sorry. Thank you. I had the ice machine going off. They are great team members. Feel like they're part of our family, even though they're on the GetWell team, but they are very much a part of Adventist Health. They are embedded deeply in our communities, and they know us well. They know the primary care team. They know the specialty care team, and they understand how to help navigate. And so, there are some that text messaging may not be their thing. And they'll just say, hey, can you call? And boom, they will jump right in and make that connection. But by far, the most people are very comfortable in that text message environment. And so these navigators will step in. They will connect people to the primary care appointments. They will answer the questions. We have them working both on what I would say the traditional fee-for-service side of the house of, hey, let's get people into appointments they haven't had. We also have them leaning in on the risk side of the house, where we are taking risk on 30,000, 40,000 people up in Mendocino County and stepping into that space and making sure that they are healthy, making sure that they have the tools that they need to continue on their wellness journey. Because again, our strategy for both sides is let's keep people healthy and keep people well. But we have found that human touch, stepping behind the tech, to be kind of the secret sauce to making people feel that, hey, I can do this, and there's a human out there who's got my back.
Sure. And Michael, these navigators are clearly an integral part of your services to healthcare organizations. So can you talk to us a little bit about the benefit to patients who seem to really appreciate that personal human touch?
Yeah, I mean, I guess those of us who have been in and around this industry for a long time know that, look, care management and care navigation works. And if we could afford to literally hire and employ a navigator for every patient, we'd have the best care like on the planet. But we know we can't afford that. And so I think, I guess for starters, the thing is what this really is all about is tech enabling and scaling care management and navigation. And I think the technology does the vast bulk, of the lift. But augmenting kind of either a client staff, they may have a very small care management staff, they may have one person calling out for post-discharge calls or what have you. So one, we're going to help scale them and tech enable them with the platform and automate a bunch. And then two, oftentimes we are augmenting with a small team of GetWell navigators to really make sure that we can get to the patients that we're not being successful getting to, or that just need an extra boost or extra help. And so these actually are local but virtual kind of care navigators. We hire them in community, so they know the local norms. They know where the local grocery store is. They kind of understand the vernacular or what have you. So they're hired locally. They work virtually. And the tech allows them to interject live chat into AI-driven chat. And so as they're noticing through their dashboard somebody struggling with a response or not responding, it enables them to kind of really reach out and be there. And I would tell you, with Adventist, they really have embraced these navigators, and they treat them like their own. I happened to have dinner out in California with 5 of our navigators recently, and we literally sat there for 4 hours and could have gone for 8 hours just telling stories about a new mom they actually talked to the day before, or an elderly man whose wife had to get to an appointment. They were helping him navigate how that was going to go happen. And so in the first 6 months, I think we've tech automated about 300,000 automated touches. But our navigators are a critical augmentation. They actually have made 11,000 calls. They actually have had 20,000 of their own live supplemental interactions to really drive the success here. So it's been, I would tell you, both from a financial standpoint and the goals that Adventist has set for us and the organization, as well as from a mission standpoint. The stories are real, and they matter, and people matter. And so we oftentimes are meeting with our teams at Adventist, sharing a very poignant story of a new person that we had a challenge touching, but ultimately got to them and really resulted in a new appointment happening or a procedure being scheduled or what have you. So it's a really important part of the model. It is driven primarily by tech, but the human augmentation is a really important piece in making this work.
Michael, I'll add to that. If I could add to that, Jacob, what I have loved about this model is our front desks are slammed. When you think of all of some healthcare clinics, if you've been a patient or you work in one, phones ringing off the hook. It is an active environment, let's put it that way. And so our navigators are behind the scenes at a different pace, able to provide that empathetic, I mean, we want that at the front desk as well, but there is a different rhythm to the connection, and there's time. And I know that our consumers are feeling that, and they're feeling the love, and there's just hope that healthcare is taking a turn. And these navigators have given some air and some oxygen to our front desk teams to have a little more bandwidth. And it has been a tremendous blessing to our teams.
Hey, Jason, just one more thing on this. As we talk about all the time, our staffs are strained. Look, our patients are incredibly stressed. The world has dealt us a hand as people, in our country and across the world. That's been a very dynamic one, as we all know, the last couple of years. And we also know that that's kind of really resulted in a lot of strain and stress on our staff as well. And I will tell you one thing that I know our team at GetWell thrives on, and I know the Adventist team does as well, is understanding the impact we're actually having. And so we have an internal kind of Slackish channel that we call Patient Love here at GetWell. And so it is a stream, all day long around these patient love stories, just anecdotes around who we're touching, how we're touching them, impacts we're actually having. And it provides such fuel because this work is hard. And the business of healthcare is really hard. The business of being a supplier in healthcare is hard. And so I think it's a really interesting way to think about doing things at scale and automating them, but making sure that we don't lose sight and we hardwire in these human touch anecdotes, because they really do provide both impact as well as psychological and emotional fuel. That's really important for our teams to have as well on the ground.
I think one of the most intriguing aspects about this partnership is just how quickly we've seen an impact regarding re-engaging patients. So, Jason, I'm hoping you can share some of the early results that you've seen.
Absolutely, Jacob. I would say the Dormant patient activation campaign has been probably one of our most successful initiatives. Reaching out to 160,000 patients. That was our first wave. We know there's well north of 600,000 opportunity there. And it exceeded our wildest expectations. This is a tough time in healthcare. Let's all be honest. The first quarter for many in the country, it's been absolutely devastating if you follow the news. And it's the whole pandemic has been incredibly challenging in healthcare. And so it is incredibly important for all of us to be able to share the return on investment. And at the same time, we know we must take cost out of the system. So we're not generating revenue just to drive up expense. I believe in the long term, when it's the right type of revenue, we're actually going to take some expense out. When we can find a cancer early, when we can close a care gap, we know that we have over 1 million open care gaps. When we look through our electronic medical record and see the people that haven't had their mammograms, haven't had their colonoscopies, haven't had their annual wellness exams, we have a moral obligation as their healthcare partner that we know those things, to engage them in getting those screenings and getting those checks to ultimately save lives. And that is the exciting thing, is when you find the right digital partner that has the tools to reach out and engage and pull people in and then connect them into those care opportunities, we will ultimately save lives. Yes, there'll be some revenue with that, but in the big picture, we'll take cost out ultimately and we'll save lives. So $8 million in revenue just from that first 160,000. We had over 40,000 visits that generated, whether it's a primary care, whether it's a follow-up specialty care, whether it's deeper levels of care that they needed. Incredible opportunity. And we know, based on the success we had with the first group, as we light up the next, we want to make sure we have the capacity for it and all the places that we serve. We believe we will be far north of that number as we complete this throughout the rest of 2022 and re-engage all those dormant patients. It's been incredibly successful.
Yeah, clearly some really amazing early wins there. Michael, can you talk a bit about the imperative to bring these inactive patients patients back into the system to receive care, but also about why a digital engagement solution is the right choice approach.
Yeah, Jacob. But first, I just want to plus one on the business piece of this. You know, having worked in kind of patient engagement now for 2 decades, it has historically been seen and budgeted for as a cost center. And while we're all very well intended and we know we have to make these investments, you know, it is harder and harder, of course, to make them in the face of the tremendous challenge that all of the health systems, certainly that we work with, you know, in the hospitals and the clinics that we work with, are kind of under right now. And so I think like one of the big pushes that Jason gave us early on was, hey, you know that consumer first matches directly to our mission at Adventist Health. At the same time, like here, again, bringing us in, here's the reality of our financial challenges. We've got to find a way to not be indirect, but be very direct, you know, in the financial ROI and model like of these programs, because it will help us fund more and more things we actually want to go do. So I think the one thing I would really push on is consumer engagement and digital first can be a profit center, not a cost center, if actually designed right, and then driving mutual accountability with the partners. And then third, look, Adventist made a lot of investments to set this up for success, and they continue to. And I think Jason mentioned one earlier, when you have a 90+% textability rate, we do a lot of these programs all over the country. Like, this is amazing. Like, if we can get to 90% of the people through our AI and SMS, we're pretty confident, and thus we'll go at risk knowing that we can go touch folks and really help kind of drive the behavior. Now, as far as like, you know, the importance of the imperative of bringing these inactive patients back, I don't want to belabor, everybody knows this. Our consumers have been through a lot, man. They've been in their homes, they've been away from people they love, they've been away from the professionals who have taken care of them in the past, and we're seeing the downstream effect of pushed off primary care visits, of delayed procedures, of missed chemotherapy treatments. Like, we're seeing this actually play out, you know, across the country, and I'm sure across the world as well, in addition to some of the isolation and anxiety and depression we're seeing as well. And so, hey, look, re-engaging people around their health is a critical social importance, you know, as well as a business one. And doing it digitally is, we believe, the only way to do this, to augment the very precious human resources that we actually have. We can't possibly manually like reach out to all these people, you know? And so I think the combination of aligning this on the business side, committing to kind of the mission of treating every patient like an individual, and then using digital to kind of scale it out is kind of how we think we're seeing the data play out, and it's actually pretty powerful.
Absolutely. Let's talk about what's next for Adventist Health and its partnership with GetWell. I want to ask both of you about, what do you do next with this approach, and how can you build and expand upon what you've already done? So Jason, let's start with you on this and talk a bit about digital care management and what this means to you at Adventist.
Yeah, so think of, you know, the entire care continuum, having that digital connection, you know, whether it's in that very, very upstream in the wellness and prevention space, whether it's kind of in the midstream in that urgent care visit, primary care visit, or whether it's more in the downstream and, you know, really the sicker stage and someone's actually in an emergency department or in one of our hospitals. But it's having that coordination of care and that connection. So the first time Hope pops up on their phone, they already know Hope. And it's a 5-digit code that's unique, smart code, unique to Adventist Health. So it's not mixed in with any other partners, but is, wow, this is Adventist Health reaching out. I've talked to Hope before, and I know that, yes, she is our AI, you know, front person, but behind her is the beautiful human touch of the GetWell team. And so it is the full digital care management. It's the automatic check-in to the clinic visits. It's the appointment reminders. It's the, you know, it is the ability for them to text message a question, us to respond to that, this bi-directional that, you know, yes, we still have the 1-800 number that you can call. And yeah, there's going to be 10-15% of the population. That's just their comfort zone. And so we've got to be able to continue down the traditional models. But when you have so many people who are embracing, not just the millennials, but right up to my parents, embracing kind of the new tech and the communication through digital and texting, and it working so well by capturing the, over 90% through our registration process, we've got to lean into that. And that is by far the bulk of the people that we serve. And so it is focusing on the right care at the right time in the right place, and letting that all be coordinated through this texting, through the cell phone. They were getting people the care they need, and they feel that they're a part of it. They're engaged, they're empowered. And again, that's why we love the partnership with GetWell, is their deep years of patient engagement. And so, their solutions on, bring your own device, people that have a cell phone or an iPad in the hospital setting, and engaging them through, this is a space they've been leaders in for decades on the inpatient space. But I love as they've been pushed to get outside of the hospital and start covering the full continuum. And that is the space that we're pioneering new ground with them. And so we're thinking of, that is our greatest opportunity. Stop getting into episodes of care, and it's just a complete health partnership as their health provider with this digital care engagement partner of Adventist Health.
Yeah, Michael, what are your thoughts on that, on the next steps of this relationship, but also what digital care management means to you at GetWell?
Yeah, I mean, I think I won't repeat. I think a lot of what Jason said is kind of, where we're heading. What they're taking, and we really have embraced it here, is a real holistic view of how can we think about patients as people, how can we actually be involved in their lives longitudinally, and I think that said, like, you can't just stay up in the clouds. You got to get very tactical. And so I think, like, the current dormant patient programs, the current work in their cardiovascular service line with putting people on digital care plans that we call loops, at kind of GetWell. I think that work is, it's happening, it's underway, and we're seeing some great early results. But there also is work to do in the hospitals. Look, we started the company based on a personal cancer experience I had. I spent way too many days in hospitals with chemotherapy and surgeries and all. And I would tell you, when you go into a hospital, it's kind of like the abyss of your life experience. You are disconnected from kind of family, friends, work, all the things that you're used to kind of having at your fingertips. It is very unsettling. And oftentimes people describe, like, the worst 3 days of their entire life was the time they were actually at the hospital. And to be honest with you, like, we believe we can change that. We actually can really make, a hospital stay one that feels personalized and connected as well. And so, we are doing a bunch of work, pushed a lot, by Jason and the team in Adventist to say, hey, let's think about that 3-day or 5-day or 7-day hospital stay, not as some, like, independent episode, but as part of a longitudinal journey of helping people live their best lives through the lens of their health, through their health. And if they happen to end up in a hospital, we better make sure that this feels kind of connected. And so we have recently been rolling out some pretty unique and dynamic tools inside the hospital setting as well with Adventist. And so picture someone on their own device, and look, everything from ordering their meals to telling people the room is too cold, to watching their favorite movie, to being educated about their meds, to kind of searching their kind of whiteboard on their own phone to kind of see who's taking care of them today, are all things that we have a chance to do. And that hospital stay should not be an abyss or like, a hole in communication. It actually should just be part of a journey that I'm actually on as a patient of Adventist Health. And hey, you know who I am, and now you know I'm here. And now you're actually going to help me make sure I can feed myself when I'm actually here and order my favorite food, whatever the kind of case may be. And so there's some real opportunity to take the strength of these ambulatory outreach tools to know a patient longitudinally. And if they happen to get admitted, we pick right up where we actually left off, and we kind of keep them connected to their care and really just deliver a really dynamic, experience while lying in that hospital, not just for the patient, but for the family themselves, because oftentimes we are surrounding patients with kind of care teams in these kind of environments as well. So just a lot of opportunity, I think, across the continuum to really have an impact.
Yeah, sure. And Jason, what are you most looking forward to in regards to the creation of a digital-first experience at Adventist? Apologies for talking over you.
Yeah, no, I will add to what Michael said. COVID has been such a challenge on an inpatient space for all of us. And so what we have appreciated about GetWell's solution is that people can take it home with them. Those of you that have been in the patient engagement space in the inpatient setting for years, realize, it's an expensive proposition. You got to have the, Cat 5, Cat 6, the back of the TV. You got to have the big TV. You got to have all this, infrastructure. And so being able to leverage a patient's iPad, their cell phone, connect wirelessly to the network, and this is all on the web now, people can take it home with them. So great education content, and it becomes a seamless experience, because how many times have we been in a hospital and you kind of forget what your nurse shared with her? You want to have those care plans and discharge plans going with you. And so love the scale, I guess, it's given our care team to have the additional resources in the inpatient setting. As we continue to push through COVID, we will continue to take this deeper into the organization. And but Michael said it well. It's that we can't just be siloed in an inpatient experience. We have to realize that people have come to us. And if you go to the next slide, Jacob, we're really leaning into focusing on post-discharge navigation. And so we have over 700,000 patients who come to our emergency departments each year. And we have tried diligently to call 100% of them back. And you can imagine a phone number you may not recognize. Very few of us actually answer that phone call. And so we have about a 17% connection rate. We make 3 tries, kind of a best practice, to see if we can check in with everyone who's come to one of our emergency departments, just follow up. And we would love to plug them into primary care if that didn't get scheduled, and like make sure that they followed up with that. But this tech is allowing us to start to reach out. And again, with 92%, we will be able to, in this summer, light this up, send a text message out there. Hey, this is Hope checking in on you. They can hit 1, 2, or 3 and let us know if they'd like a follow-up call. Maybe everything's just great, but we'll get the credit for reaching out, doing the right thing. And we will also save lives when someone said, man, I was meaning to reach back out. I just haven't had time. And we can get a clinician on the phone with them immediately. So we're going to do this with our 700,000 discharges a year in the ERs. And then also on our inpatient, about 106,000 inpatient discharges a year. And go from a pretty pathetic connection rate by trying to reach out through traditional telephone calls and have Hope be our first point of contact. So this is one of the things I'm most excited about this summer, is lighting this up and giving some help to our care teams that are trying to squeeze those discharge phone calls in, and they just have not been making the connections, and we're missing 80% of our patients.
Right, absolutely. Essentially through this entire webinar, we've been walking through the patient's journey from before a care episode all the way through an inpatient day and now after they've left the hospital. So Michael, what are the benefits from your perspective to continuing to engage with patients after they've been discharged? And how does that contribute to the goal of providing whole person care and improving the health of the patient population?
Yeah, I guess just really briefly, so we can get to some questions, but I think that, look, one of the most important parts of a patient journey is when we as patients leave your incredibly skilled hands and we're back out on our own at home or at work, we need support. And at times we need a lot of it because it's complicated. And it's not just complicated around our health, but our lives are complicated. And so life gets in the way of staying healthy and keeping us at our optimal state from a health perspective. And so I think there's such an opportunity, and the health system is and should be and will be, if done right, the trusted resource for me to navigate my health, for my family and I, so long as we stay connected in a kind of personal, continual way. So I think there's an unbelievable opportunity to leverage these kinds of tools to create those lifelong, not just relationships from a business standpoint, but actually to make sure that patients have a navigator in their pocket, to help navigate their kind of life journey to lend to their health, because it's the complicated one. And if we can be that source of navigation and guidance, we can really help improve the care and help lift people up.
Before we conclude, Jason, any other early wins you'd like to share or things that are shaping where you're going next?
No, thank you, Jacob. We're eager to jump to questions. I'll just, put the exclamation point on, it's important to find a partner that just truly understands patient engagement. That is, everyone can do, many people, let's say, can do this type of tech, but it is the right voice. It's the follow-up with that human touch. And it is helping people to feel that they are cared for, that they are loved, and that it is an authentic connection, because as more and more organizations lean into texting, all business verticals, it can get to be noise. And so you want to, just like this graphic here, you want to have that same loving touch even when we move into these innovation spaces. But thank you. Let's do some questions.
Yeah, absolutely. And we do have time for a couple questions from our audience. Just so our audience knows, you can still submit any questions you do have by typing them into the Q&A chat box on your webinar console. But let's go ahead and get started with one from our audience. And Jason, I know you had briefly touched on this, but one of our audience members is a bit curious about how the expectations are changing for many older patients that are not necessarily comfortable with using the technology that we've talked about today. So how do you meet their needs in this changing environment?
Yeah, I think we have to keep the legacy opportunities still out there, the 1-800 phone number, and we have to continue to support that community. We need to continue to lean into more languages and embrace our full populations that we serve. But we have seen, continued adoption of the cell phone, of that phone number. It's going down, and we're able to start offloading. And as Michael, I think, mentioned, those 14-minute call holds, those are coming down. As we can get more and more people into the digital space, our operators are able to work through the queue at a faster rate. So we have to acknowledge that not everyone is comfortable in this space, and we have to be really comfortable that most people are, and not be afraid to lean into this because of the narrative that, our most senior won't be comfortable. We've got to go down both tracks.
Yeah, absolutely. One of our audience members wants to know what the triggers are to get the navigator to actually reach out to the patient.
So part of the platform is, as you would expect, kind of a care management dashboard, if you will. And so we are tracking in real time, like the automations, that are kind of going on and all the interactions. And so what's happening is, like, what they're seeing is a queue of, hey, this many messages kind of went out today. 94% of the patients are actually, they're responding, they're actually moving along with it. And to the extent that someone puts in some kind of comment, or a certain trigger that says, hey, I don't really like doing this stuff online, for example, like that would actually show up in a queue for one of our GetWell navigators, and that would actually prompt them then on their list to make that call. I think we had an example earlier. There was an older patient who said just that. She was very concerned. We had reached out to her as part of a dormant patient. She had responded back to the extent of, hey, I went online, it says it's not an appointment for 4 more months, kind of thing. And so our navigator jumped on the line with her, connected directly with the clinic, and found her a canceled appointment to kind of get there quicker. So we, of course, have dashboards that actually our navigators are using, and they're viewing these 360 profiles on an individual basis, but they're actually viewing them, as a universe to see who needs an extra either live chat or an actual phone call. And that's kind of what their workflow looks like on a daily basis.
Got it. Jason, how do Adventists, primary care physicians, interact with GetWell when it comes to knowing what was discussed, reviewed with their patients through the digital app?
Yeah, that is a tremendous opportunity for us to get all of our clinicians, and I think that's a great learning that we've had going through this, is we would love to see even more engagement. We have not gone full-blown on asynchronous health, where this is not the platform where a patient would put in a concern and a physician would respond. That is not a space we've leaned into at this point. They're well aware of it. We are using it at this point to engage. I would say we've had great physician adoption with our loop going down in the Central Valley on diabetes. They are engaged in that, helping design. We've got cardiologists helping design our cardiology loop for 3 of our big hospitals where we're doing cabbages. And on the primary care side, though, that is a tremendous opportunity for them to, they're aware and they know that the navigators are making life easier to create access. But that is the next opportunity that Michael and I and team have continued the vision of how can we continue to push deeper, and can this be the platform that we get into some asynchronous health?
Yeah, Jay, just to I think you're drawing a really important distinction. So when we're deploying programs that are really focused on kind of outreach, navigation, and retention, the job both of the tool and the navigator is really to navigate that patient back into a primary care visit or a follow-up or what have you. And so the physicians themselves to Jason's point, currently are not directly involved in that at all. Now, we're collecting some pretty important and unique information around social determinants, anxiety levels, questions they may have, that downstream may very well be, if we can figure out how to get it into their workflow in an efficient capacity, may help them make their visits more efficient and effective when they actually get into the office. But in those kind of retention and outreach programs, it's really focused on navigation. There's really no kind of clinical stuff going on at all. Now, on the digital care plans, on these loops, those tools are being monitored in real time, by an assistant, an MA, a medical assistant or so, or somebody in that office. And escalations are happening if somebody actually needs a different level of clinical care, as part of that care plan. But on the retention tools, it's really more of a navigation strategy, if you will, versus a clinical delivery strategy.
Michael, I want to stick with you and ask a little bit more about the data you've shared about re-engaging inactive patients. How can other organizations get started with outreach to their own populations?
Yeah, so I think I'd say, first and foremost, and most organizations have this, is kind of just understand your data and be okay with it being imperfect. And that just means that's okay. I think it's you start by choose a population or a service line or a burning issue. For example, PCP visits are down. Discharge follow-up is sporadic. Readmissions are high. Our orthopedic surgeons are seeing increased competition and lower volumes. ED visits are up. Pick something that actually is really important to the organization and kind of understand the data and be okay that it'll be imperfect. For example, if you don't have a 90% textability rate, which you may not, it's okay. It doesn't mean we do nothing. It just means we figure out, how to leverage the 60% or 40% we actually may have, and then what's the other data trigger that we actually may be able to get from a different system to make sure we can get to the rest of the patients, number one. So one thing's about data. I think the second thing is, look, find a technology partner, and it doesn't have to be us, but not one with generic capabilities around texting, but one that actually has depth in specific programs that matter and undeniable return metrics that they're willing to kind of sign up for and kind of have both shared accountability and shared risk on. And then, no joke, I know it sounds cliche, but it's find, trust, and love the partners that you choose. This work is too important and it's too hard to do it without shared values and alignment. When you have that, hey, this work's messy and it's hard and we'll make mistakes together and we're going to have to iterate and figure it out. Because healthcare is complicated and consumers are doing 45 different things at once. And we do have 16 systems that can't connect anything in the health system. And so I really think that actually finding that is critical. Our team that works with Adventist has never worked this hard. And at the same time, they've never felt more fulfilled about their work. And it's a testament to the partnership. It's a really important element of the whole thing.
Jason, any thoughts on how to get more executive support in this direction?
That's key, and it's got to start in the C-suite, because this is a complete fundamental change for the entire health system to say we are going to connect differently with our consumers. We're going to build relationships, moving away from transactional healthcare. And so Michael mentioned it. He joined our strategy summit last July, and we had 2 days of meetings with our board, of 60 senior executives. And so we knew this is where we wanted to take the organization. And I challenge any of you that are needing to take your organizations on the same journey to model this. It worked incredibly well. We used GetWell, and we started about 30 days before the summit, sending text messages to these 60 individuals, preparing them for these meetings. We'd send out the agenda. We would send out fun questionnaires about what's your favorite candy bar, which we had sitting in the room for them, showing them that we knew them. We would send the day of, we would start sending the weather the week before as they were packing. We sent a map of how to get there. And so they were just getting probably 20 to 30 different, very relevant and meaningful interactions leading up. And we had GetWell Navigators backing it up if they had any other questions. And so in my keynote at this event, I was able to talk about, how did it feel? Did you feel like we knew you? Did you feel prepared for this summit? Did you know what we were going to cover? How was your engagement? They said, the best communication ever, bar none. Usually we just get an email that we barely read. we were so excited to be here. And then the mic drop moment is, well, how much more important is it for a hip replacement, for open heart surgery, than just a 2-day event, that we connect and communicate. And so the very decision makers were all in on, let's do this for our patients. Let's transform the way that we engage as a health system. And so that might be an approach that would be, if you're struggling with your organization, to have them get it, would challenge you to model that.
Jacob, before we move to the next or move to close, it's funny, I mentioned earlier, teams never worked as hard. And I mentioned with Jason, there's this combination of, honestly, thinking big but working small. I'll never forget the call when he said, hey, we'd like you guys to be a part of the summit. It's in 25 days, and we actually want to run an outreach campaign and build a loop to get people prepared. We don't have that loop. He's like, I know, but you told me that it's dynamic, so let's make it happen. So, but it is. I would tell you, like, having people experience the tools firsthand was so incredibly important, because when they are going for a knee, or they're having a baby, or they're having open heart surgery, man, oh man, does it make me feel good that you actually know who I am, you're communicating and engaging me. So it's just another example of, like, how you lead with force, in a very challenging and distracted time. It just gave us all kind of great clarity on what to go focus on.
Absolutely. Jason, last thing I wanted to ask you about is the data that the partnership with GetWell it's producing for Adventist. Are there any categories or fields of insight you're finding particularly valuable? And can you share any ways that you might be leveraging what you're learning from that?
Yeah, I think, again, one of the questions I know is how do you choose the right partner? It's someone who's willing to go on a learning journey with you, because we are, kind of paving new ground in some ways. And so some things have worked incredibly well. Some voices for hope have connected better than others. And so we're continually willing to learn from, what is getting a better click-through rate, which dormant patients, when's the best time to reach out, when's the worst time. Clearly sending text messages at 2 a.m, not a good strategy. So we've got to just be very intentional that they know this isn't spam, that it's not just long HTTPS junk in the lines that you click on. And we have really refined the messages that they get, because we're all starting to get, clickbait that you click on, and who knows what you've just given people access to. So I think the learnings we're getting by where are people feeling the most comfort, and when are they needing to convert to a navigator, and how can we better answer that question and use hope differently so we don't need to convert to a navigator. We love that they're there, but if we can be even better on the digital side and not have to convert to a phone call, it just scales them all the more. So it's an evolution. We are continuing to learn, and it's fun to have a partner that is just as excited about being in this space, and not a vendor, but a true partner, and cares just as much as we do about every interaction.
Well, the thread throughout all this seems to be that a personalized experience puts the patients first, and that caring and empathetic approach is certainly worth emulating. Definitely sounds like you both have some exciting and impactful plans ahead of you. That is all the time that we have for today. I want to thank Jason Wells and Michael O'Neill for joining us, and thank you to the GetWell Network for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you all so much for joining us today here at Becker's, and we hope you have a wonderful afternoon.
Take care.